Hi friends, welcome to my first session Quality in Healthcare. Myself Sujata Sahu. I I will take a session on the quality in healthcare. So let us understand first what is quality. So everyone is having the concern in the healthcare quality is not maintained or quality is there, quality is not there. So what first we need to understand what is quality and what the meaning of quality in the in the regular life of ours. In the daily life, what is quality we need to understand first. So let us start. So let us think that we visited one hotel and we have experienced the stay in the hotel. So when we are entering to the hotel, what and all we are seeing, that we are seeing ambience, we are seeing the cleanliness, we are seeing the behavior of the staff, the quality of the food, the quality of the material provided. So what and all we are experiencing, and we are that is satisfying us. Quality means what? Quality means quality is not a things that it is like by we can hold it. We can't we can measure the quality by difference. We can measure the quality by different characteristics which has been set in our mind. It's not a measurable quantity that we can measure in a kilo or any measurable things. So the quality is a touchable and experiencing things where we can experience the quality and we can express that the quality is good or bad. And for every person's the quality view is very different. It's depend upon the person to person how the quality was. Maybe the quality of the hotel what I have stayed is good for me, but that is not good for the other person because their expectation is high than me. So the quality is the thing where the expectation meets. If our expectation meets, then the quality is good. If our expectation not meets, then the quality is not good. So the thing is that, and for to measure the quality, nowadays everyone is having the rating skills. You go to the hotel, you go to the shopping malls, you go to any uh, shops, everyone, and you go to the healthcare also. We have the rating scales for the quality to measure. So uh, then when we are going for a shopping to buy a cloth or any dress, what we are seeing, we are seeing the quality of the dress. What is the quality then in the dress? The quality is stating that the thickness of the dress, what we are purchasing, the cloth is transparency or not, how durability it is, how beautiful it is, the fitting of the cloth is good or not, is the mention size is coming to me or not. So every each and every variable are depend upon to define the quality of a product. Similarly, in healthcare also we have the criterias where we are defining the quality. So let us understand what is quality. The quality is what I already explained, that is beautiful, attractive, durable, meeting standards, healthy, value for money. How it is satisfying one person from the service, how the expectations meets of the customers, how the thing is, how they are doing the right things and they're doing it well. But in a bookish language you will find that in a inherent degree of bookish language you will find the degree to which a set of inherent characteristics fulfill the requirements and the pre-established criteria of the standard. What is the established criteria? The criteria is no one is establishing, the criteria is establishing by the human being. Whatever we are getting in our daily life, we are defining it, we are putting in the standards, and we are experiencing it how it's coming out. So that is called quality. What is quality in healthcare? Healthcare, the terms of quality is bit different, but it is not much different in the daily life of ours. So in the healthcare quality, the quality, it means that clinically effective and efficient, affordable healthcare services. People want everything should be in the minimized cost, but it should be effective and efficient. So if we are providing the maximum services within the minimal cost, then the people will experience that yes, the quality is good and they have delivered very pleasantly. So what kind of services? The services kind of waiting time in the OPD consultation. If we are having more waiting time in the OPD consultation, then definitely we are not meeting our standard, we are not meeting our TAT time for the patient, where we are failed to give the quality of services. So the waiting time to be defined by the healthcare facilities, which they can adhere to that, and which can be displayed in the OPD consultation waiting area. So patient will have the patients to patients for the consultation to consult one consultant, and where the organization also can meet the quality of the standards. Communication skill of staffs. Always the organization staff should be trained in the communications, because communication is the most important thing in the organization, in the healthcare organization. If our communications toward the patient will be polite, and through communication if we are able to subsidize the pain of the patient, then the patient will feel much more happy than the treatment. Obviously treatment is the part of the patient pain management, but the thing is that if you will behave properly, then your communications, your behavior towards the patient will increase the patient confidence, and will decrease the patient pain, and patient will feel comfortable, where the quality of your healthcare organization will go up, and the patient will be happy with that. Answering the patient query in a polite way, in a satisfactory manner. If you don't know the queries, then just tell the patient that I will find out and I will let you know. Don't tell the patient directly to that, no, I don't know, you can check with others and all. So where the patient will be dissatisfactory, and patient will never turn up to you. So where you are losing your patient, and where your quality parameter will go down. Maintaining of the records of the patient. Maintaining of record, yes, in patient we are maintaining the records, but it is equally required for the outpatient as well. So if we are maintaining the outpatient record, every time patients are not coming from the home directly to the healthcare for the consultation. Sometimes patient can come from their relatives house, from their office directly, where they are forgetting to take the previous prescriptions. But yes, if we are having the prescriptions with us, previous records with us, which will help them to get their previous consultation reports, and that will get easy for the patient to consult with the doctors and to get treated. So where the patients will be happy, and they will rate that yes, we are maintaining the quality. The records are not only for the patient's requirement, it is for the organization requirement also, where we can legally prove that yes, we have treated correctly to the patient. So next is like cleanliness of the bathroom. The thing is that in our daily life also, the whenever the people are comes to your home also, everyone will see that if your bathroom is clean, then you are maintaining the hygiene of yours, and your they will find that okay, they are providing the good services when the patients are coming to your hospital. If the bathroom is not cleaned, or the hygiene is not been maintained properly, then obviously you are losing your patient there, because that is the face of the hospital, where the people are visiting the hospital and for the test, for the urine test, or for any kind of test, they are visiting to the, they are going to bathroom, and they are finding that the cleanliness of bathroom is not there, and where they are getting that the getting infections. So instead of getting healed, if they will get the infection, then they will never turn up. So cleanliness of bathroom is equally important in the healthcare. A is equal to the cleanliness of the floors. If floors are not cleaned properly, then this also will spread the infection, where our quality is going down. Giving a IV injection properly, if we are keep on punching the uh, if we are continuously pricking one patient 3 to 4 times instead of giving one IV injection in one prick, then patient definitely will tell that we don't have the experienced staff, we don't have experienced persons to handle. So it is equally important to have an experienced staff in our OPD and IP and emergency is equal in the inpatient wards, ICUs, OTs. Generally, the people are thinking that uh, it is important to have the staff in IP ward side, ICU side, because their patients are getting admitted, they are staying for 3 to 4 days. But it is equally important when the patient is visiting to the OPD. If in OPD we don't have the experienced staff to handle, then the take a patient will go out from the hospital from OPD itself. They will never turn into IP. If the patient needs to be converted to IP, then the patient is required to be treated properly in the OPD. So the giving IV injection properly also is the parameter of quality. Setting up a crash trolley so that it can be used for the patient as and when required. So the crash cut is equally important in the hospital, where the pharmacy also is there, or the uh, defined services are available, because the crash trolley is the emergency trolley, where we are having the emergency requirement to revive the patient wherever the patient is getting crashed. So that one trolley which will be having all the emergency medicines, intubations requirement, where we can provide immediate attention to the patients and immediate recovery of the patient. Washing hands before touching a patient. So hand wash is equally important in the hospital, where we need to uh, where we are seeing that every hospital is having the hand washing poster in every corner of the hospital, wherever the hand washing facilities are available. So hand washing hands are equally important, where we are defining our quality. If in front of the patient you are not washing your hands, you are touching the biomedical waste and you are touching the patient simultaneously, then patient will tell that what quality you are maintaining. So where we are losing our quality in healthcare. So washing hands are equally important before touching a patient. Then counseling a patient about the disease, counseling also a part of quality, because the counseling a patient is important where the diseases are turns out is positive. Like you take the patient's HIV test has come positive, patient SBSG has test come positive, patient so where the counseling is required for the patient about the patient disease conditions. So if the counseling is not done properly and we are not meeting to the patient's daily basis about the patient's relatives, about the patient's condition and the updation of the patient, then also patient will think that we are not treating the patient properly. So where the counseling also is required, and where we have to maintain a counseling record for the patient. These are all the quality requirements where we need in the healthcare, which are the major quality requirements. All the patient's records, the waiting time consultation, the cleanliness of the rooms, bathrooms, floors, treating the patient properly with the experienced staff, then the crash trolley, then washing hands, then counseling the patients. Everything is important in the healthcare to maintain the quality. One patient entry to the hospital to defining the quality, measuring the quality, improving the quality during her the stay of the stay in the hospital for the treatment. It's all about the quality. When patient enters to the hospital, they will define the quality. They have certain characteristics set in the mind that okay, the staff needs to be attend us on time. Whenever the call bell press, patient staff should be attend to us. They should give medications on time. The cleanliness should be on time. There should the bathroom, the room should be cleaned properly. Whatever the dresses we are providing to the patients, that to be cleaned properly. They should not be torn or any loose clothes we are giving to the patient where the patient privacy are not maintained. So then wherever we are providing the bed sheets, so bed sheets are should be neatly cleaned and washed cloth bed sheets should be put in the bed. Wherever there should not be any hairs or any blood stains in the bed sheets. The From the housekeeping to the maintenance to the nursing staff to the consultant, each and every person is equally important to measure the quality. How the administration is required, equally to the treatment is required. So the quality is defined from the patient entry to the hospital to the treatment of the patient get treated and discharge. If the patient get so patient enter to the hospital where we have to see the waiting time to not be there, and patient waiting time for the consultation, waiting time for the admission, waiting time to shift to the patient to the ward, waiting time to shift the patient to the OT, waiting time for the patient shifted back from the OT, waiting time the patient press the call bell the to that patient attended by a staff, medications on time, cleanliness of the rooms, bathrooms, hygiene of the staff whoever attending the patients, consultants communication. Then residents doctors communication, staff communication, administrative staff communication, meet experience measurements of the patients. Then and wherever we are finding that, yeah, this patient is not satisfied there, we need to improve our quality. So to improve the quality, if we have the patient complaint system on place, then it will be easy to improve the quality then and there. Like, if we have the complaint system on place, every hospital is having the feedback system. Patient feedback and patient complaint, these two things are very different. Patient feedback we can take at the time of discharge, but patient complaints should be taken then and there immediately. Wherever the patient is facing a issue with the call bell, then and there patient should have a system that they can raise a complaint, and the complaint to be attended within 5 to 10 minutes of the patient complaint raised. So that system is important in the healthcare, where our complaint raising system can be allotted, and our HODs or whoever the department HOD, they will get the alarm that this system is not working or your staff is not responding. So they can allot the team and they can resolve the issues then and there. So the most of the issues will be resolved before the discharge, so patient will be happy with that, and where we can improve the quality. So why the quality is needed in the healthcare? Quality is required for the to wear a brand cloth, to enjoy in our holidays in a best locations and with the best hotels, where we can happily spend our time. But why it is needed in the healthcare? Why, who is the beneficiary from that? The quality is most important in the healthcare, because the in the healthcare also, if we are not maintaining the quality, then we can't treat the patient properly. So who and all will get the benefit, patient and family members will get the benefit, staffs also will get the benefit, hospital also will get the benefit, and insurance company also will get the benefit. What the benefit the staff, a patient will get? Patient will get the good health outcomes, where we are maintaining the hygiene, we are maintaining the standards, we are maintaining the international standards to treat the patients guidelines. Their patient will get the health outcome better and more earlier, where we are reducing the length of stay of the patient in the hospital to reduce the infection rate. Client satisfaction, patient will be satisfied with our services and value for money, and there will be less frustrations. Staffs become the more satisfied with their work. If the everything will be in a standardized manner, then it will be help to the staff to perform their work in a easier way. Health workers understand the patients better. Continuous education, patient will be staffs will be getting the continuous educations. Then uh, help staffs, then the staffs will be rewarded as per their performance. Then staffs will be happy with their achievements. Hospitals will get the benchmark to the society. Then the expectations of the patients will meet from the services of the hospital provided. Environment will become more clean and beautiful. The facilities will keep a good reputation to the society. Insurance people also will get the empowerment with the third parties, and the Nowadays all the insurance companies is having the, if the hospitals are not having the accreditations quality, then they won't do the tie-up and all. Whenever the insurance companies are getting contracted with getting the contract with the patient, and they are taking the insurance from the patients, that time they are committing to the patient that they are providing a quality services in the hospital where they are having the tie-up. So they are having the reliable and certified information on the facilities, infrastructures, and the level of care. So this is only the overall of the quality in healthcare what I have done a video on this. Gradually my videos will come on the different department wise and the requirement of the accreditation. Next video I will upload on the accreditation, what is accreditation, what and all the types of accreditation, and the requirement of the hospitals. And so thank you so much. If you people like my video, then please like it and subscribe my channel. For any informative videos and more videos, you can comment the topic, then I will create the video on that. Thank you so much.